Pancreatic cancer is one of the most difficult cancers to treat, with patients on average having less than 7% chance of survival 5 years after diagnosis. Currently, the only potential cure for this disease is surgical removal of the tumour. However, in 80% of cases, patients are deemed ineligible for this surgery, as the cancer is commonly diagnosed at an advanced stage after it has already spread and infiltrated critical and delicate arteries. These patients are given chemotherapy. However, it is palliative and it is very ineffective. And this ineffectiveness, in large, is due to the thick, dense tissue that surrounds the tumour called stroma. This stroma acts as a protective barrier for the pancreatic tumour, and it physically blocks drug penetration. So while the patient is experiencing all of those very toxic side effects from the chemotherapy, it isn't actually doing much to treat the cancer itself. So my research is looking to find a way to break this quite literal wall of tissue. And we're looking to do that by developing a biodegradable polymeric implant that we can load with multiple chemotherapy drugs to actually insert inside the tumour where it can release the drugs over an extended period of time. This will begin to kill the tumour from the inside, shrinking it to a size where we can then go in and surgically remove it and therefore potentially cure it. One of the major benefits of this localised therapy is the lack of toxic side effects the patient will experience, as the drug release is limited to within the tumour only, which will make a very significant difference to the patient's quality of life. We've designed these implants to be inserted using a clinical technique called endoscopic ultrasound-guided fine needle injection, in which an endoscopy camera with a needle attached is passed through the mouth and down to the stomach, where the implants are injected directly through the stomach wall into the tumour. This is a relatively non-invasive procedure, as it avoids major surgery and has very little downtime for the patient afterwards. All of the materials and drugs we've used in this project are FDA approved, and by using a clinically approved implantation method, we envision that progression into clinical trials will be fast-tracked. Furthermore, our novel fabrication method allows us to form implants using a very wide range of polymers and drugs, which makes this technology applicable to a number of different cancer types. So in conclusion, we envision that with further development, these implants have the potential to improve not only the overall survival, but also the quality of life of patients with pancreatic cancer. Thank you.